Okay, we're looking at chapter 14 and we're on lesson 14.5, which is the control of heart rate for A2 biology. Now, before we move on to the control of heart rate, we actually just need to look at how the heart operates in terms of generating an action potential and that wave of electrical excitation passing over the heart. Let's just imagine the gross structure of the heart like so. Now, there's a region in the heart called the Sinoatrial Node. It's a patch of tissues that have an excitability about them. Whereas before, in previous lessons where we learned about the sodium, potassium channels and how perhaps disruption of that in the Pacinian corpuscle, for example, an influx of sodium ions, you needed the stretch-mediated sodium channel for that to actually happen. Just like with the rods and the cones in the eyes, you need light to land on them for the chemical to split. So you need a stimulus. They are neurogenic. However, this patch of tissue here, the sinoatrial node, the cells there don't need anything. They are naturally undergoing an action potential all the time. It is myogenic. They don't need an external stimulus for that action potential to happen. But clearly we need to be able to control our heart rate to meet the demands of our muscles. So we need to be able to speed up what the sinoatrial node is doing, and we need to be able to slow it down. But that's what 14.5 actually moves on to. First of all, we're just going to talk about when an action potential occurs here. Let's remember that the heart is basically made of the four chambers. We've got our atria, we've got our ventricles. Coming from here, the electrical impulse, when an action potential is generated here, it spreads out across the atria. So the action potential spreads out across there. When it gets to here, there's a thick band called the atrioventricular septum. A septum is a flap of skin, almost like the one that separates your nostrils there. So the atrioventricular septum is a thick band of tissue, almost like scar tissue, and this wave of electrical excitation is unable to pass through here. Of course, the wave of electrical excitation is followed by a wave of muscular contraction. So as that passes over there, it's followed by the contraction of the muscles, and they squeeze the blood into the ventricles. So that blood now is being squeezed through these valves into here. So how do we get the blood out of the ventricles? Well, there's a node. Think of it almost like a little button, if you like. There's a node here, and again, it's called the atrioventricular node. And that does allow the electrical excitation to pass through it. And in fact, think of it like a bundle of wires that pass down the center here. This bundle is called the bundle of His. Clearly the name of somebody who discovered it or did some work on it. And that bundle of His carries almost like an insulated bunch of wires down through the septum that separates the ventricles. And as it comes to the bottom, it then frees up and is uninsulated, if you like, and these are called the Purkinje fibers. So what happens is we get this wave of electrical excitation, a wave of muscular contraction follows, the blood is squeezed into the ventricles, and there's a slight delay of about 0.2 seconds. And that delay is what's happening is the electrical impulse is travelling down that bundle of His, and that's the amount of time it takes. And then the electrical excitation starts from the apex of the heart, the pointy bit at the bottom. That ensures then that the wave of electrical excitation squeezes the blood this way, and of course we know that the blood vessels kind of come off like this, and that's the direction we need the blood to go in. So we get a contraction, an action potential followed by a contraction of the muscle, squeezes the blood that way. The electrical excitation is stopped here. It carries on down the bundle of His, given a slight time delay, which is great because that enables the atria to completely empty of their blood. And then the wave of electrical excitation starts from the apex upwards, and that's great because that pushes the blood, when it's followed by a wave of muscular contraction, in the correct direction.